I do call this lecture Sick and Tired of Feeling Sick and Tired, but it's really about exploring disease through the lenses of functional medicine. And we're going to do that in a couple of ways. So these are our learning objectives. Of course, we're going to find out what is functional medicine for those of you who don't know. And how does it differ from conventional medicine? What is the body system approach to disease? And what is the functional medicine prescription? So I'm going to take you through step by step those learning objectives. So first off, just a little bit about me. As Terry mentioned, my name is Janine Cacapola. I'm an osteopathic board-certified family physician. I opened a functional family medicine medical practice in Barrington last June called Heightened Health. And we have, Oreo is always the highlight of the office. He's my therapy dog in training. And I swear those are the only Oreos that are allowed in my house or in the practice. Okay. But the important stuff is really just to give you an idea of who I am and what I'm about. I'm married. I have 2 children who love to go see the Schaumburg Boomers. I'm very much into healthy cooking and smoothies. I dabble in guitar, and I'm also getting my purple belt in Taekwondo, which I really love. So that's my stress reliever. Medicine is really my calling. I have wanted to become a doctor since I was 3. That's myself and my beautiful mother and a Fisher-Price stethoscope, and really that's where the seed of this passion began. But more than that, everyone has a why. So you all have a why of why you decided to take the time to spend an hour with me tonight, and whether it's because you're going through some symptoms or conditions that you're concerned about and want to get a little more information perhaps on a different perspective on it, or you have friends or family that are suffering, or maybe you just thought it would be an interesting way to spend your Wednesday. But my personal and professional journey has led me up and down, and I'm going to give you my case because I think it brings it down to earth, and so that you understand kind of where my passion for medicine and a functional medicine approach came from. So in 2 minutes or less, prior to age 36, I plowed through life. I didn't have any significant medical problems, thank God. However, when I look back, my health had really been deteriorating over at least 5, if not 10 years. And it acutely worsened after the birth of our second child. And, typical symptoms. I had really severe exhaustion, terrible brain fog. It was very difficult to function. Headaches, migraines. Every time I get out of bed in the morning, I felt like I was, 80 years old with just aches, just hurt all the time, and GI distress, the details of which I will leave out of this presentation. So I did due diligence. I got to the point where I said, I can't just suffer through this anymore. I'm going to see some of my colleagues. I saw rheumatology and neurology and sleep specialists and GI, and they did their job. They looked me over, they got the blood work, and then everything came back, and you heard those words, it's all normal. But you still end up leaving with some ICD-10 codes that say, okay, you have fatigue, headache, IBS, myalgias, which is muscle pain, and I went from 0 medications to about 5 or 6. And I just thought to myself, this can't be right. There's got to be more to it than this, because there's no plan for improvement. These just treat the symptoms, but I'm not going to get any better with taking these medications. And what's the end game? Do I have to keep taking them and taking them? So it really gave me cause for concern, but also kind of a turning point of how was I going to approach my own health? And it made me think, if I'm experiencing this, how often do my patients experience this with me? So I started researching, much like you do. I hit the internet and started looking around and discovered functional medicine. And I was like, why haven't I heard of this before? And one of the things that functional medicine practitioners do, I think, that is very important in taking a history. It's not just, okay, you have hypertension. high cholesterol, migraines. They want to know what happened from your birth all the way up the line. What are the ATMs? Those are the antecedents, triggers, and mediators. What are the things that you know, potentially made this train go off the tracks? And so you start to look at symptoms as outward signs of underlying physiological imbalances. They also, functional medicine practitioners that is, really want to use food as primary medicine, because if you don't start there, you're going to miss the boat. The second point is lifestyle medicine is really the foundation of better health, and it's paramount to achieving wellness. And we'll go into that further towards the end of the lecture when we talk about the 5 key components of the functional medicine prescription. And so really it's a very basic action plan if you want to take umbrella terms. We remove the bad, okay, we add in the good, and we look to restore and balance. So I had the luxury being a physician. I ordered some of my own advanced specialty labs, and they're not common in conventional practices. I did saliva testing and stool analysis and, you know, extensive blood and urine nutritional analysis. And guess what? It didn't come back all normal. It was very much abnormal. And I started simply. I said, okay, I'm going to remove the things that I suspect are not good for me. Gluten, dairy, and sugar. And I know some of you are probably tuning out right now and going, that's it, I'm done, I'm out of here. How can I live without those? I tried to the best of my ability reducing stress. That's not the easiest thing to do when you're a mother of 2 and have a busy medical practice. But I think the take-home message from reducing stress for all of us is setting up boundaries, being able to be confident, or I should say firm but kind in your no. No, I can't take on another project. No, I can't do that for you right now. I can't do something else for somebody, because the more and more we extend ourselves and have less time for self-care, that's where some of that degradation of our wellness comes into play. Also removing toxins, buying more organic foods and home and makeup products. And then adding in whole foods, quality supplements, good sleep hygiene. I can tell you for years and years I was severely sleep deprived, and some probiotics. And it was really that core that I got better. Now it took some time. It took some persistence. It took some trial and error. I don't want anyone going off thinking, well, you know, you just turn that around in a week and everything is hunky-dory. But it really gave me pause to think that I could not only heal thyself, but then bring this message to my patients. So it really changed me personally. I maintained some long-term lifestyle changes, and my health continued to improve. And then professionally, it completely changed the way I wanted to practice. So I ended up leaving my former practice on very good terms, I might add, because in conventional medicine, as you may know, you're often put into a 15-minute time slot. So I'm seeing 4 to 5 patients in an hour. That doesn't leave a whole lot of time to get that backstory. It doesn't leave a whole lot of time to figure out, where is my patient in the realm of an action plan? Are they, you know, pre-contemplative stage? Are they at an action stage? Are they 5 steps ahead of me and want to do everything, but then they burn out after 2 weeks? So the most important reason is really time and being able to do things in a manner that's conducive to healing. So I took an educational sabbatical and opened Heighten Health last year. So getting back to our first learning objective, what is functional medicine? Functional medicine addresses the underlying causes of disease using body systems-oriented approach and engaging both patient and practitioner in a therapeutic relationship. What does that mean? So let's break it down so that it sounds in English, in layman's terms. So underlying causes of disease. One of the questions we continually ask is why? Why is this happening to the patient at this time and in this manner? What's going on? You've got to dig deeper. And being able to use some advanced specialty labs to uncover different imbalances if need be, whether that be genomic markers, metabolic markers, nutrient levels. But we need more information sometimes than conventional labs offer. Body systems-oriented approach is referring to human physiology. What's driving the train off the tracks? Is the symptom the result of being a dysfunction or a compensation of normal function? Or are things going okay in a particular area? And finally, the therapeutic partnership. This is really the secret sauce, because if you bring back the doctor-patient relationship, you allow the patient a space for healing. And that doesn't always mean that a functional medicine physician can cure a disease. There are some diseases that we can't fix, but it doesn't mean that some healing can't occur, and there is a difference. And the most important difference is just listening to your story. So how does functional medicine differ from conventional medicine? Well, it does so actually in several ways. First off, it's health-centered. So rather than looking at what's the disease and what are the FDA-approved pharmaceutical drugs to treat it, we want to know, okay, what's going on so that we can get you back to a better state of health. It's patient-centered rather than doctor-centered. I want to know from my patients, when I give instructions, what they feel they're really able to do, because it doesn't pay for either one of us to get a whole list of things, and they're really not at a point where they can do more than one or two of them, and that's okay. You know, sometimes baby steps are perfectly fine. It really focuses on the interconnectivity of organ systems rather than being specialized. One of the beauties, I think, of being a family doctor, and also a challenge, is that we see everyone from infant to grandma, and we're dealing with all body systems. But that also gave me a fantastic foundation for functional medicine, because I don't have just a specific scope, and I have the availability of still referring patients for conventional tests if they're still needed. Cost effective. I can't tell you how many times patients will say they've been to umpteenth number of doctors and they're not getting anywhere. So in some respects, some of the advanced tests might be more, but if you get the answers that you need and you can get on a good individualized protocol, then it is more cost effective. It identifies root causes of symptoms and disease rather than symptom and disease management. That's probably the biggest difference. There is more of a preventive approach versus early detection. Let me explain that difference. So early detection is a woman goes in for a mammogram and they find an abnormality on the radiograph. That's early detection, and it's, let's say, stage 0. Prevention is saying, what puts you at risk for having breast cancer to begin with, and what do you need to do to reduce that risk? That's true prevention. And it's high touch, high tech versus just high tech. One of the things in my practice that's probably different than what many patients are used to is it's just me. I'm a one-woman operation, so if there's a patient concern, they call me, I pick up the phone. There's not these layers and layers and layers of administrative staff and medical assistants, and I use technology to the best of my ability, and helping patients learn to love it so that they can better connect with me and use that technology to improve their health, I think is really incredible. So the old paradigm of conventional medicine is that you have a team of healthcare professionals in different specialties. No one asks, how is everything connected? And oftentimes maybe doesn't talk adequately to one another to come up with a plan. Conventional medicine, name it, blame it, tame it, and match the pill to the ill. I mean, that's really how, when I was trained, you do your research on a given medical condition. We'd end up scrolling past the pathophysiology and all of that mumbo jumbo of what actually is going on, and just get to, okay, what's the latest treatment? Boom, there we go. And symptoms may be reduced, and labs may be normalized, but the disease state persists. So, you know, conventional medicine, we love to name things. We love to just call it by the ICD-10 codes, and we never stop to think that there's really only one end game when we do that. And patients often continue to get more symptoms, more diagnoses, more drugs, more surgeries, and I don't think it gives patients a good enough sense of empowerment. The burden of chronic disease in our country is pretty astronomical. I mean, we are spending money on healthcare at an astronomical rate. It's currently almost 20% of our gross domestic product. And if you haven't noticed, we're really not doing that great as far as getting patients well. In fact, we're one of the sickest countries in the world. So it kind of makes you wonder what's going on. Now, this doesn't mean that our healthcare is all bad. If you have acute conditions such as you have chest pain that's radiating to your arm, you get your patootie to the hospital right away. We're great at acute problems, heart attack, stroke, sepsis, which is terrible infection, other things like that. But when it comes to prevention and reversing chronic disease, we really fall short. So as I said, 80% of this is preventable because it's due to lifestyle, and that's what we're not addressing. So this is our buddy Albert Einstein. Insanity is doing the same thing over and over again and expecting different results. We're just kind of hitting our heads against the wall sometimes. So I'd like to introduce a new paradigm that actually has been around for almost 30 years now, that is functional medicine. And it asks two simple questions. Why is this happening? Does this person need to be rid of something? Toxins, allergens, infections, the standard American diet, stress. And then how can we repair, restore, and rebalance to normal function? Does this individual have some unmet need that they're requiring to return to optimal functioning? And so functional medicine looks at the opposite end of this linear graph. We want to get you from symptom to health to the best of our ability. We want to identify and address these underlying processes and prevent and reverse chronic disease wherever we can. So what primary interventions do we use? Well, we want to eliminate things that are bad for us. What are the toxins in our environment that we can easily get rid of? Sometimes just choosing better home cleaning products is a good place to start. For all of the ladies in the room, did you know that we put on almost 200 chemicals to our skin before we even leave the house? So our makeup and moisturizers and things like that can be really toxic. One of my preceptors in functional medicine said that if you wouldn't eat it, don't put it on your skin. Allergens and intolerances, this is a big one. I can't speak to mold too much because that is not an area that I have studied greatly, but definitely, you know, foods, pollens, and other chemicals where our body system, our immune system is becoming so hypersensitive, it's overloaded. So if you suspect that a certain food may be not sitting well with you, get rid of it and see how you feel over the next month. Microbes, bacteria, yeast, parasites, viruses, stress, of course, physical and that which is perceived. And then poor diet, the standard American diet, which is highly processed, high in unhealthy fat, high in sugar, and low in nutrition. So part 2 is, so what do we, once we remove all that, what do we need to add? Whole nutrient-rich foods, preferably organic, specific nutrients and or phytochemicals, so those would be like, you know, let's say you're deficient in vitamin D, or you tend to be prone to seasonal allergies, you might need some extra vitamin C or quercetin. Environment, this time of year we're finally getting some more light, so everyone generally feels better, but making sure that you stay hydrated and get enough restorative sleep. Movement, of course, is very important. Many of us end up sitting at a desk for 8 hours or more, so getting up hourly is important. Our relationships, sometimes our relationships can be really toxic or stressful, and I think it's important for patients to identify those and improve where they can, or not spend as much time with those people that drain them of their energy. And of course, finding meaning and purpose in what you're doing on a daily basis. So when you start to look at diseases from a functional medicine perspective, you begin to wonder, are there some connections in all of these? Because I don't know about you, but for myself, having gone through what I went through and having seen patients in practice, a lot of patients end up with multiple diagnoses in these categories. So we start looking at chronic diseases and trying to see, okay, what are the dietary influences causing this? What are the lifestyle habits that this patient has? What's the genetic predisposition? And what's the environmental load? So those are external, factors, where they live, where they work. And all of those things have what's called an epigenetic effect. So you can't change your genetic code, but you can change how they're expressed. And that's where lifestyle medicine really has the greatest impact. So these genes can be turned on and off. So if you have a predisposition for diabetes, because let's say your mother had it and her brother had it and a few cousins have it, that doesn't mean that you are destined to have diabetes, but it does mean that you are at increased risk. So you need to do things to turn on the genes that improve insulin sensitivity so that you don't get high blood sugars and you don't get insulin resistance. And that's really good news because that's empowering. So our lifestyle choices affect how we function on a very cellular and molecular level. And that gives us hope and empowerment. Thomas Edison back in 1903 said, "The doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease." And of course he was brilliant, but he pretty much summed it up right there. So lifestyle and genes, it's simple math. What you eat affects your genes. If you eat poorly, you're going to be at more risk, you're going to have more disease and more quality of life. If you eat healthy, that's a more positive impact on your genes, less risk, less disease, better quality of life. Now I'm really simplifying it, but the take-home message is whatever you do, whether it's eating or movement or lack thereof, these are either hits or hurts to your body every single time. So the good news about that is, if you're on a stretch where, let's say you haven't been exercising too much and you haven't been eating too well, like over the holidays, the good news is that your body essentially regenerates every 90 days. So you can start over. And in 90 days, I guarantee you're going to feel better if you're consistent. The third learning objective, what is the body system approach to disease? Well, this talks about finding the root causes. So the lenses of functional medicine, this is just an important view. We want to have, there we go. We want to have a telescope view. We want to have a panoramic view. And then we want to have a microscope view, because all of them are very important. You want to get a whole idea of what's going on with the patient. You want to be able to look at what's going on with their body systems, and then you also want to be able to know what's going on a cellular and molecular level. So the way this works in a manner that kind of compares conventional focus to a functional medicine focus is that when a patient comes in with a chief complaint, conventional medicine is on the top of the iceberg. We're on the effects. Okay, what symptoms are they having? What signs are they having? Meaning, do they have high blood pressure? Do they have a headache? What are we going to diagnose them with? And what is the conventional treatment for that? That is the effects-based approach. Functional medicine tries to look at what's underlying the tip of the iceberg and identify and address the upstream physiological causes. Okay, so that's the cause-based approach. So when we look upstream, we're looking to see where the spark is coming from. So rather than just treating down here, which, by the way, if a patient has severely high blood pressure, I'm going to give a medication. But I also want to start looking at what other things are causing them to have high blood pressure. Do they have areas in the body that are inflamed? Do they have associated insulin resistance? Do they have oxidative stress? And then going back further, what's their genetic risk? What are they doing in their, what are the effects of their environment that they're living in? And of course, what are their lifestyle choices? So where do we start? Well, the best place to start is to listen to the patient's story. What are the antecedents, triggers, and mediators? So antecedents set you up for problems. That's your genetic risk. So if there's a family history of stroke or heart disease, it's what happened in the womb. You know, did your mom smoke when she was pregnant with you? Or was there considerable stress during her pregnancy? Were you born via C-section or vaginal delivery? Were you preterm or full term? Were you breastfed or bottle fed? Did you have a lot of sweets and candy as a kid at a very young age? Those are things that kind of set the stage for potentially having problems even decades later. Triggers are things that basically you have an event, and after that event, things went downhill. So that could be, you know, you have surgery, and though it fixed one problem, you notice that since that surgery, something else is just not quite right. Mediators are things that perpetuate a problem. So if you have a very obnoxious boss and you have to work in a stressful job, that is a mediator. And then we take this information and we create a timeline. And oftentimes when you get that timeline, if nothing else, it gives the patient an idea of, oh, you know, rheumatoid arthritis didn't just drop out of the air and hit me at age 52. There were set points that actually pushed me towards having an autoimmune process. So getting back to this slide, these are all the different things that can potentially lead to chronic disease. Standard American diet, sedentary lifestyle, indoor living, adverse life events, financial stressors, and so on. So let's look at my case. So in my case, I was bottle fed. I have a big family history for irritable bowel syndrome, big family history for headaches. My mediators, let's see, I had multiple childhood antibiotics. Like I had a gallon of penicillin every month for a recurrent infection and fever that nobody knew, but every time we take you to the family doc, here's your prescription for penicillin. So it wasn't until age 3 that I wasn't getting monthly antibiotics and had my tonsils out and began to not have that as part of my life. A huge mediator for me was, of course, my medical training and chronic sleep deprivation and inability to have time for self-care. Other triggers, I moved away from home to go to school, so I didn't really have family support close by. There were, of course, acute stressors in my training, you know, losing patients to illness that I developed a relationship with, having a busy practice. In residency, I had several acute GI infections, I'm sure from exposure at the hospital. And then let's not undermine the significance of like creating another human being. Those are high stressors for a woman to go through, not just the whole idea of motherhood and what you have to do parenting, but the whole pregnancy process. So along these points, you know, the arrows for me of different symptoms just kept building up until I was at a point of needing to do something. So when I see patients and in a functional medicine, as part of functional medicine training, we learn about the functional medicine matrix, which basically takes all the things that I just talked about and puts them as an analogy of a stool. So there's the three legs of the stool. There's the ATMs, where we're retelling the patient's story using their antecedents, triggers, and mediators. We want to focus on personalizing lifestyle factors, and then we want to organize their clinical imbalances, and we take all that information and we come up with a personalized protocol. So that's basically that sheet upright so that you can see. And I just want to focus in the middle. We don't want to lose sight of the mental, emotional, and spiritual components are really at the core of our healing and of ourselves. And then surrounding that are the 7 core clinical nodes that I'm going to go through in a minute that helps us better understand where these conditions, medical conditions and symptoms are coming from. Okay, so the 7 core clinical or physiological imbalances. The first is assimilation. That has to do with your digestive tract, your lungs, and your skin. How well are things, the good things getting in and the bad things staying out? Defense and repair. This has to do with your immune system and inflammation. If there's any imbalances, this refers back to a healthy microbiome, which is basically the good bacteria that's in your gut. Energy. This has to do with how well your body takes the food substances that you eat, carbohydrates, proteins, and fats, and converts them into fuel in the form of ATP. ATP is what every cell in your body uses to function. So if you can't assimilate protein, break it down, make it into its building block, which is amino acid, and then convert that to fuel, you're going to feel tired. You're going to have headaches. You're going to have brain fog. Biotransformation and elimination, that has to do with how well your liver can detoxify. Detoxification is very important for health because we're bombarded with bacteria, viruses, toxins, allergens, our own hormones all the time, and our liver has to be in good shape to be able to take those things and convert it to something less toxic, and then ultimately we either pee, poop, or sweat it out. Communication. This has to do with all of our hormones, not just are we producing enough, but once they make it to the site of impact, are they locking on and making that lock jiggle to have an effect in that cell? So we not only are talking about our adrenals, thyroid, sex hormones, but also neurotransmitters in the brain. Transportation, this has to do with our cardiovascular and lymphatic systems. And then structural integrity. This goes from a microscopic level, how well, what are the membranes of the individual cells? Do they have the right components to maintain their structure? But also a macro level, where we want to look at skeletal and organ integrity. So assimilation. So one of the things that makes neighbors good what do they say? Good fences make good neighbors. If you don't have a good microbiome, or if you have spaces between the individual cells in your intestines, i.e. leaky gut, you're either not going to properly absorb nutrients and or you're going to let in a lot of bacteria, toxins, allergens that you don't want. So that's assimilation. Defense and repair, as we talked about, is focusing on our immune system. Our immune system has to be robust, but it has to be intelligent. You don't want an immune system that is reacting to everything, otherwise we would die from a paper cut. So you want a system that understands, nope, this is self, I want to calm things down. Oh, this is an enemy, I want to attack that. And when people experience autoimmune disease, their body has lost tolerance to self. They think that self is the enemy. So, for example, Hashimoto's thyroiditis is when our body makes an antibody to our own thyroid. I love this slide because it just gives me a headache looking at it. But if you just take a step back for a second, and now obviously I'm in medicine, so that's my passion, but if you take a step back and realize the number of metabolic processes that are happening every microsecond that have to work properly for you to be healthy, it's amazing. I mean, the human body is just amazing. So the point being is if you have a deficiency in one place, it's going to have downstream effects. That's all I want you to take away from this slide. So if you are missing B12, you are going to do more than have B12 anemia. You're going to have problems with methylation. You're going to have problems with DNA repair. You're going to have problems with nerve conduction, all of these things. So the take-home message is one defect in one place has downstream effects. So to give you an example, I talked about before when we eat foods and we have to convert it to energy, on the bottom there, those are all the nutrients we need to do that, to move those building blocks of food down the conveyor belt and make ATP for the cell. So if you're deficient in B2, B12, carnitine, magnesium, coenzyme Q10, your cell can't function properly. And on a most basic level, the cell's going to be tired. Okay, detoxification and elimination. Much like I said, you know, we want a healthy liver. The liver does multiple processes to make our body environment less toxic for us, and then it can get excreted. One of the things to consider is what's our patient's total toxic load or total body burden. Oftentimes occupation is important to know about. You know, is someone a painter? Are they dealing with pesticides? Are they working in a nuclear plant? Things like that. The communication node, as I mentioned, has to do with our hormones and our neurotransmitters. So when you think about it, you not only have to have the right soup of ingredients to make the hormone, but then it's got to get to the right place. It's got to lock on. It's got to make that lock jiggle and then have its effect. And there's a huge influence in various what we call axes in the body, meaning that there's the brain adrenal thyroid axis, there's the gut-brain axis, so that one is influencing the other very much. And we're learning more and more, especially about the microbiome in the gut, how these trillions and trillions of bacteria that we have are releasing hormones and releasing nutrients as well as neurotransmitters and other things that affect our brain function, particularly with mental functioning and mood. Transportation and circulation, you got to get the stuff from point A to point B on a large scale level, like blood vessels, but then you also want to have the membranes of the cell be able to let things that are on the outside of the cell in or on the inside of the cell out as appropriate. And structural integrity talks about basically the makeup of the membrane of the cell. So it has to have the right nutrients to do that, mainly omega-3 fatty acids. And then also, of course, structural integrity if someone has back pain or arthritis or something like that. All right, mental break. Take a breather. Right now your head is probably going to explode. All right, so this is God at his computer. This is my favorite one. Having dumped the bag of ashes on the table, Stu hid behind the door and waited for the X-ray technician's reaction. And this is Midvale School for the Gifted. So, I love Far Side. All right. So one of the ways to think about this, when you see the matrix, everything's connected, right? It's all interconnected. It's very intricate as well as complex. So it's like a spider web. And we'll see that, you know, one condition, like anxiety, can have many different causes that influence that symptom. And by the same token, there's one imbalance, like inflammation, can lead to many different medical conditions. Same point here is just that, you know, when we have stress, it's not only affecting our mood, but it actually influences our brain, our sympathetic nervous system, and then you can have chronic stress, at least, have ill effects causing insulin resistance, central obesity, inflammation, hypertension, osteoporosis, and a bunch of other problems. So we can't get rid of stress, but we certainly can react differently to it. Okay, so what is the functional medicine prescription? First off, it's foundational. It makes a positive impact no matter what. No matter how old you are, no matter what your medical conditions are, small changes are always going to be good. There are 5 key components to the lifestyle medicine. It is highly patient dependent. I mean, you know, you have to have consistency in doing it. You have to have commitment in doing it. And success may be variable at any given time because of that. I mean, let's face it, life happens. There are some months that I'm just awesome at working out and getting in my taekwondo, and there are other months, like over the holidays, where I just can't fit any more things in my schedule. But it can definitely be transformational. So we always want to keep in mind the 5 components. It's sleep and relaxation, movement, nutrition, stress management, and relationships. Okay, when those are in sync, you are golden because they're always going to have a positive impact. Now, at any given time, as I said, you might be sleeping well, but your diet's not that great, or you're not able to exercise that much. But what I want you to understand is when you're trying to get help for your conditions, if these components aren't addressed, you're not going to get very far. And this is the stuff that the doctor can't do the work for you. We can only direct you in that. But food is always going to be first, because any one of these lifestyle factors impacts all of the nodes on the matrix. And why is food first? Well, because food is information. It regulates that gene expression. So when we talked in the beginning of the lecture about the epigenetic effect and turning the good genes on and the bad genes off, that's what we're talking about here. Food is medicine. It has anti-inflammatory effects. It can have anti-cancer effects. It can have analgesic, is lowering pain. It can be stimulating or calming, much like dark chocolate for myself. That is on the food plan, so that's 70% or greater. Food is nourishment. As we talked before, when we eat, those building blocks of carbs, fats, and proteins needs to get converted to ATP. Food is cultural. I mean, we have a lot of rituals around gathering and prepping food, cooking and eating. And food is social for friends, family, and enjoyment. Now, by this point in the lecture, either people are like, sign me up, or this is not for me. So if you're like, man, I love functional medicine, I want to learn more about it, I do want to set some expectations. First off, I don't have any magic wand. I don't have a silver bullet, fairy dust. I can't predict the future. This is hard work. if you're dealing with chronic medical conditions, it is complicated and it is complex and it does take time. And it's important to be persistent. It's important to be your own advocate. As I mentioned before, in regard to especially lifestyle factors, you know, we can bring a horse to water, but we can't make him drink. So I have lots of tools in my toolbox, as do other family medicine, or excuse me, functional medicine practitioners. But compliance is important. Keeping you motivated is important. And it's not just one supplement that's going to make the difference for you. Oftentimes it is it's a protocol. It's multiple things having a positive impact that eventually can cause, hopefully, a transformation. The other thing I want to mention is that it is normal to hit roadblocks. It is normal to have obstacles. And really, when you have a team approach with a physician, hopefully, you know, you can navigate through those together. As I mentioned before, sometimes it is not possible to cure a disease, but it is possible to instill healing, and that's through the doctor-patient relationship. So, in summary, I'm sorry that's ended up on the bottom there, but we determined the functional medicine definition. We talked about how it's a new paradigm, it's a new framework for thinking about chronic disease and addressing chronic disease from conventional medicine. Functional medicine uses a timeline and matrix to help retell the patient's story and address physiological imbalances. And we talked about the functional medicine prescription, the 5 key components of the modifiable lifestyle factors, and that any of those, starting any of those at any time is going to have a positive impact as long as you stick with it. And it's because all of those affect epigenetics or gene expression. So I hope this gave you a way to kind of rethink health problems and wellness. I always enjoy coming here.